Welcome back, everyone. Today we're talking about a life-saving emergency drug, noradrenaline, that is especially used in septic patients and other critical situations. So, let's get started with the video. First of all, let's start with the introduction to noradrenaline and understand what it is. Noradrenaline, also known as norepinephrine, is an organic chemical from the catecholamine family. It actually works in more than one way, as a hormone that's released into the bloodstream, and as a neurotransmitter that carries signals between nerve cells. Our bodies release it naturally during the fight-or-flight response, like when we're under stress or when blood pressure suddenly drops. But in emergencies, when blood pressure falls to dangerous levels, doctors give norepinephrine from the outside. This helps mimic the body's own response and quickly raises blood pressure. That's why it's called a sympathomimetic, meaning it copies the body's natural way of protecting vital organs like the brain, heart, and kidneys. Now, how noradrenaline works in the body, its mechanism of action. It primarily works by binding to and activating adrenergic receptors located on the surface of target cells. These receptors are divided into alpha and beta subtypes, and norepinephrine has varying affinities. It has a high affinity for alpha-1, alpha-2, and beta-1 receptors, a moderate affinity for beta-2, and negligible activity at beta-3 receptors, which is not clinically significant. Its effects depend on the receptor subtype, the dose, and the tissue context. Now, the effects of norepinephrine by receptor type. On alpha-1 receptors in blood vessels, it causes vasoconstriction of both arteries and veins. This increases preload and afterload, leading to a rapid rise in blood pressure. On alpha-2 receptors, it reduces further release of norepinephrine, acting as a feedback control system. On beta-1 receptors in the heart, it increases the force of contraction, that's the positive inotropic effect, and usually raises the heart rate, known as the positive chronotropic effect. Norepinephrine has minimal beta-2 activity, unlike epinephrine, so it does not cause significant bronchodilation or vasodilation in skeletal muscles. Overall, its main emergency action is through alpha-1-mediated vasoconstriction and beta-1-mediated cardiac stimulation, which rapidly increase blood pressure and maintain blood flow to vital organs. An important point to remember is its dose-dependent effects. At low doses, norepinephrine mainly emphasizes cardiac stimulation. At high doses, norepinephrine constricts blood vessels very tightly. If a patient has hypovolemia, meaning low blood volume and IV fluids are not given first, norepinephrine may still raise blood pressure but can reduce blood flow to organs like the kidneys, gut, and skin. This lack of blood flow can cause organ damage. Now that we understand how norepinephrine works in the body, let's move on to its clinical uses and see where this drug is most important in practice. One of the most important clinical uses of norepinephrine is in septic shock. Septic shock is a life-threatening condition, usually caused by a severe bacterial infection, though viruses or fungi can also be responsible. The infection triggers inflammatory chemicals that make blood vessels dilate and become leaky. As a result, blood pressure drops very low, and vital organs like the brain, heart, and kidneys don't receive enough blood supply. So why do we use noradrenaline? The main risk in septic shock is organ failure due to low blood flow. Fluids alone often cannot maintain blood pressure. How noradrenaline works in the body. Norepinephrine is the first-line vasopressor in septic shock, as per clinical guidelines. By activating alpha-1 receptors, it constricts blood vessels, raising systemic vascular resistance and blood pressure to maintain a target map of 65 millimeters of mercury or higher. Its mild beta-1 effect supports cardiac output. Dosage carefully adjusted to prevent excessive vasoconstriction. The next important clinical use of noradrenaline is in neurogenic shock. Neurogenic shock happens after a spinal cord or brain injury. The injury disrupts sympathetic nervous system control, causing widespread vasodilation and hypotension, often along with bradycardia. So why do we use noradrenaline? Without sympathetic activity, blood vessels remain fully relaxed, so the body cannot maintain adequate blood pressure. How noradrenaline works in the body. Norepinephrine replaces the lost sympathetic tone. By stimulating alpha-1 receptors, it constricts blood vessels and restores blood pressure. Another clinical use of noradrenaline is in cardiogenic shock. Cardiogenic shock is a critical condition where the heart fails to pump enough blood to meet the body's needs, resulting in very low cardiac output and severe hypotension. Why is noradrenaline used? The biggest risk, similar to septic shock, is that organs like the brain, heart, and kidneys stop receiving adequate blood supply. Fluids alone are often insufficient. How noradrenaline works. Noradrenaline is sometimes used as a second-line agent. It works by stimulating beta-1 receptors to make the heart contract slightly stronger, while alpha-1 stimulation increases vascular resistance and raises blood pressure. However, it must be used carefully because too much vasoconstriction can put extra stress on the already weak heart. For this reason, it is often combined with drugs like dobutamine to balance the effects. Noradrenaline is also used to manage hypotension during anesthesia or surgery. Certain anesthetic drugs can relax blood vessels too much, leading to a dangerous drop in blood pressure during surgery. Why it is used. Noradrenaline is used to manage dangerously low blood pressure during an operation. Oxygen delivery to vital organs like the brain and heart decreases, which can be life-threatening. How noradrenaline works. Norepinephrine given as a short infusion, it activates alpha-1 receptors to increase vascular tone and stabilize blood pressure. Let's talk about the routes and dosage of norepinephrine. First, discuss its routes. Norepinephrine is usually preferred in intravenous infusion, and the drug should be diluted in 5% dextrose solution to maintain potency and prevent oxidation. The FDA recommends not using saline alone. Dilute norepinephrine in 5% dextrose to keep it stable. IV bolus route is unsafe because it can cause a sudden spike in blood pressure and arrhythmias. Oral route is not used because norepinephrine is quickly destroyed in the gut and liver. That's why it is not available as a tablet. Now talk about its dosage. Initial dose. Start with 8 to 12 micrograms per minute as a continuous IV infusion, adjusted according to blood pressure and clinical response. Once the patient stabilizes, the dose is usually reduced to 2 to 4 micrograms per minute. In critical shock, higher doses may be needed, sometimes up to 30 microgram per minute or more, but always under strict monitoring. Now we talk about its side effects. When we give norepinephrine, the most important concern is with the heart problem. It can make the heart beat too fast or become irregular, and if the dose is too high, it may push the blood pressure dangerously high. Another key issue is reduced blood flow called ischemia. Because norepinephrine causes strong tightening of the blood vessels, it can cut down circulation to places like the fingers, toes, kidneys. If this becomes severe, it may actually damage the tissue or even organs. It also affects the nervous system. Some patients may complain of headaches, feel anxious, or notice tremors. This is due to overstimulation from the drug. We always be careful with the injection site. If norepinephrine leaks outside the vein, what we call extravasation, it can cause serious tissue damage. That's why we always use a secure IV line when giving this drug. That's all about norepinephrine. If you found this video helpful, please like, share, and subscribe to the channel.